Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. This program focuses on healthcare issues and services that we have here at KRMC that will be of interest to you and your family. I hope you'll stay tuned because I've got a great guest on the show today. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Cindy Vawter. She's the Director of Marketing and Volunteers Coordinator for the Hospice Home and Hospice Program here at KRMC, right? Did I get that all right? So thanks for being on the show today, Cindy.
Thank you.
And October, of course, is Hospice Month, right? Is it
October and November.
And November, okay, so you have 2 months. And we have lots of events coming up in October that are going to bring more attention to hospice and the hospice home. So we'll talk about that today during the show.
Okay.
So first of all, though, let's talk about Cindy a little bit. Now, how long have you been with hospice?
About 4.5 years.
Oh, has it been that long already? Time flies when you're having fun. Seems like you just started there. And so part of your job, I know you have many hats that you wear with that, but you coordinate the volunteer program
I do.
For the hospice. So what does it take to be a hospice volunteer?
They go through 30 hours of training,
Okay.
and during that 30 hours they learn about hospice, and they learn about KRMC hospice, and different staff members come in and talk to them and tell them what they do.
Okay.
And they go through all the KRMC employee training and the background checks and the health requirements.
Okay. And then once they've gone through all that and they're now official, they get their badge, then what's involved with being a hospice volunteer?
Well, some of them help at the hospice home. They help on the front desk, greeting people, answering the phone, and some help in the kitchen, baking cookies and pies,
Oh, I
baking
know,
goodies.
I've been over there and it smells so good.
And if they want to do that, they have to go get their county health card.
Their food handler's card.
Food handler's card.
Right, okay.
And they help with visiting patients, they help with paperwork, they help with the gardening, the back,
Oh, that's right. We
the
have
flowers.
that beautiful garden.
They help with scrapbooking, they help with the teas we put on or the different lunches. So there's many ways at the hospice home they can help.
Okay.
And then we also have volunteers that go out into the home and are companions to our patients.
Right, because hospice is there's a couple of different parts of hospice. The main hospice program is caring for patients in their last stages of life in their home.
Right.
Right, and that's the primary point, is that allowing people the dignity to die at home with family and friends around them, and obviously maintaining their quality of life for as long as possible and trying to help keep them pain-free. But then we also have the hospice home, the Joan and Diana Hospice Home.
Right.
And that's not, not everyone goes there. Can you
Right.
explain the difference?
The patients come in, they're at home, and if their caregiver needs a rest or needs to go out of town and there's no one to care for the patient, they come in for what we call respite, and they can come in for up to 5 days at one time.
Okay.
And then they can also come in for what we call symptom management. They need to get their pain under control, their medication under control, or different reasons that they may come in. Instead of going to the hospital, they come to the hospice home. And they could be there from anywhere from overnight to up to several days. But the hospice home really has what we call a revolving door.
Okay.
They're not there for long periods.
Right. And it's, of course, a beautiful facility that we all know is built through donations from many people and organizations, but our primary benefactors, of course, were the Lingenfelters and the Becker families that helped build that. And then we have the beautiful garden in the back that you were talking about, and that's just a very nice meditation garden, and we have a lot of master gardeners, is it, that has helped with it, or no, it's not? Or just the volunteers have put that?
Rhoda, our bereavement counselor,
Okay.
has kind of taken that under her wing, and she has a few volunteers that help her. So
Very good. And that's got some nice little walking paths and a couple of gazebos and areas that even the patients or their families can step outside for a little while for a break.
And we have the butterflies where people can make a $30 donation and have it engraved with them.
And we've started bricks on the wall too, so they can buy a brick That's $50,
$50
for that. And so that'll be like the healing garden at the hospital where we have that wall of fame, but so it'll be a memorial brick that they can put up. So there's lots of options there. Now, so if someone was interested in being a volunteer for hospice, would they, who would they call? You?
They would contact me at the hospice home.
And your phone number is
681-8710.
8710. Okay, so that's if they want to be a volunteer.
Be a volunteer, and I'm planning to have another training in January.
Oh, okay, so that's a couple months away, so that's good. So they could call you now and get on that list.
Right.
Because before they can do anything, they have to go through that training first.
Right.
Okay.
So the first thing would be call me now.
Right.
And then
get on that list and give them the information. You'll be able to tell them more about it. Okay, good. Hospice, though, too, and we were talking a little bit before the show about how people still don't always understand what hospice is, and how they get a loved one into hospice. You want to talk about that a little bit more?
Anybody can call us or make a referral to have their loved one, or the person can call us and ask about hospice services. And but normally it comes from the doctor talking to the patient and the family. They're the ones who usually are the first to talk about hospice. But if not, the family can call us, and then we have a nurse that can go out to the home and talk to them about our services.
Okay. And it's I think one of the things that's kind of misinformation, if you would, that's out there in the community is that someone needs to be like a week away from death, if you would, or that it's only cancer. But that's not true. There's many different types of diagnoses, right?
Right. There's other non-cancerous diagnoses, such as COPD, CHF, ALS.
So the heart, the lungs, all those things that are the last stages of
dementia, Alzheimer's.
I forget about those too. So any of those, it's basically they need a diagnosis of 6 months or less. Is that about right?
Right. But as we know, no one really knows.
Has that crystal ball exactly.
So that doesn't mean after 6 months that they're going to be discharged. Right. They're recertified for 90 days, and every 60 days.
Okay.
And if they continue to decline, they continue to stay on hospice.
Okay.
And we do have patients that have been on hospice longer than 6 months.
Sure. Okay. And I think that's what it's important for families to know, is for family members, is the tools that hospice gives them to help them deal with everything that's going on those last few weeks and months of a person's life. And I know that we have a bereavement counselor, like you talked about with Rhoda. We have the chaplain, Denny Colvig, that can help them with that. Not to mention, of course, the nurses, the social workers.
The CNAs who can come out and help with bathing or changing bedding.
Right.
They
and
can
then
be
the
a real help.
volunteers that help as well. And they're the ones that can really step in sometimes if, like you said, someone just wants to go to a movie and get away for a little bit. They can have a volunteer come and sit with the family.
The volunteer can come in, or even sometimes the caregiver just needs to lay down for a few hours and have some uninterrupted sleep. The volunteer can be there.
Yeah, that's great. So those are all things I think it's really important for our community to know, to understand. And I mean, obviously death is a scary thing for anyone, but I think what's awesome about hospice is that it really does help the family and the patient with a lot of those decisions that need to be made at the end, and keeping that patient comfortable, the family members comfortable, and giving them the support they need all the way through the process.
And like our social workers can help with all non-medical questions,
to make sure
and
they
details.
Have, and then, like I said, the bereavement I think goes on afterwards too.
Right. For I believe like 15 months after.
Oh wow! I didn't even realize it was that long.
Rhoda keeps in contact with them and sends out mailings.
Great. So they've got that support network in place to help them deal with everything that needs to be done. Hospice is obviously a wonderful gift that we have in our community, because it's fairly new, 25 years maybe that it's been in the U.S., but just to really help people in those last stages. It's pretty amazing.
Yeah, in Kingman, we've been here since 2001.
Okay, so 11 years now.
Kingman.
Yeah, very good. And then, of course, the hospice home, we just opened the doors 3 years ago now? 2 or 3 years?
2.
2 years
July
ago.
of 2010.
Okay, very good. And that's such a beautiful facility. I've had people who have just gone in, and anybody could come to see it.
Right.
You know?
We welcome people to stop in at any time, and we will give them a tour.
Maybe a
and
fresh
we usually
cookie.
have to have a cookie or pie or coffee or tea.
Okay, very good. And that's
Yes.
812 Airway Avenue,
It
right,
is.
is the location. So it's almost to the or not Surbats. Is that Surbats on that side? Yeah, the mountains on the back side. So you take Airway past Western and right behind there. And that I think it's always good to have that information before you need it,
Yes.
to understand it and know what's available.
Yeah.
So then when the time comes, you are better prepared to make the decision.
And that's why we welcome people to come in before they need us,
Yes,
to come in and see the hospice home and to hear more about hospice services, so that if or when they do need us, then they know about us.
Right, know where to go. That's cool. Now, as we mentioned at the beginning of the show, October is a busy month. We've got a bunch of things going on during October. Let's see, the first thing, of course, I think it's the golf tournament, our annual golf tournament. That's a major fundraiser. Do you want to talk
October
about that?
13th.
Okay.
Sponsored by the foundation,
Right,
KRMC
yeah.
Foundation. And it is at the Surbat Cliffs golf course. And
I think it's $100 a golfer, and that includes everyone's going to get a golf shirt, a towel. I think Scott even set them up with a golf bag that they can have, or not a golf bag, excuse me, a lunch bag. Those are all free gifts they'll get. Plus, we have a wonderful meal catered by Chef Gall, since he's on staff now. And plus, of course, a fun day of golfing out at Surbat Cliffs. So it's a fun. And all of the monies we raise go to help support the hospice home.
Yes.
And
Scott would be the one to contact for if they want to help.
681-8656. I know Scott's number very well. I'm always passing that on. I think what it's important maybe for people to understand too, initially, of course, for many years we were doing a lot of fundraising to build the hospice home. And once it was built, people thought, oh, okay, we're done. Well, not quite, because it's the foundation is committed to ongoing support of the home until such time as it becomes self-sufficient, which is a few years down the road yet, probably. So I think, as the golf tournament and our race that we do in May for hospice, and then we have that new event, the Spirit of Hospice.
Spirit of Hospice Walk, and this year it's named after Dr. Lincoln Felter, called Doc's Walk.
Right.
It'll be October 27th, and be starting at 9 o'clock, and it's just a fun walk, a 3-mile walk around the neighborhood from the hospice home.
Trick-or-treat Halloween theme.
Right, we encourage people to dress up,
Okay.
young and moms and dads, grandpa and grandmas, and also pets.
Oh, that's right. They can bring their pets too.
And dress the pets up.
Okay.
And then we'll have stations along the route where they can go trick-or-treating.
Super.
Different departments or businesses will have a table and giving out trick-or-treats.
Good. Well, we're going to take a quick break, and then we'll come back and we can talk a little bit more about that and then some of the other events we have coming up.
Okay.
So, thanks. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Cindy Vawter. Thanks again for being on the show, Cindy.
Thank you.
So we've been talking about hospice and not only hospice, but some of the events that support hospice. And we talked about the golf tournament coming up October 13th. And then we have the Spirit of Hospice Walk in October 27th.
27th.
Okay. And it's actually now, we renamed it kind of the Spirit of Hospice Doc's Walk in memory of Doc Lingenfelter, who, of course, was so instrumental in helping us get our hospice home built, the Joan and Diana Hospice Home. And was just such an incredible man in our community. He just did so much for us, and so we wanted this walk to kind of commemorate him and what he did. And so the funds raised from that walk go to the hospice home as well. And it's just a walk, so we don't have to worry about running.
Right.
Just
3
walking.
mile fun walk.
Right. And it's a nice time of the year because by the end of October it's cooled off, not so hot, and it's nice and fallish. Fall's in the air, even for Kingman. And they can dress up in costume, you said?
Yes.
Okay. And it starts and ends at the hospice home, is that right?
That's correct, yes.
Okay.
And it starts at 9 a.m.
Okay.
So they don't have to get up too early.
Right, that's another nice thing.
And then we will be giving tours of the hospice home.
Oh, okay,
and there'll be
good.
some games set up out front for afterwards for the kids to play.
Great. So they're going to wear costumes and have different little booths along the way, and we've got lots of sponsors, I think, in place for it as well. And then, like you said, they could have a tour of the hospice home.
Right. And there's a $20 entry fee.
Okay, that's a good point to bring up.
And then they can also get pledges.
Get pledges, sponsors to raise more money. And do we have prizes or anything for if they raise a certain amount? Or
is a $15 gift card they'll receive if they raise $100 or more, and then it goes up with each increment.
With each $100. So,
and then there are prizes too for costumes.
Best costume, best pet costume, I think, is one we did last year too. So this is our second year. It's become our second annual event, and it was so well received last year. We had such a great turnout. They decided to do it again, and probably will keep doing it.
Yeah, and if I remember right, I think we had over 100.
That's right. We did
people
for our first
last
event.
year.
That was pretty impressive. So anybody that's interested, can they call you for more information?
They can.
Okay. And what's your number again?
681-8710.
Okay.
And I'll have entry forms there at the hospice home too.
Great. Very good.
That they can pick up or I can mail out.
Okay. Super. Now, one more thing that's happening in October, and these events are all kind of leading up to November being Hospice Month. You know, every month seems to have either a service or a health issue. Like October is usually Breast Cancer Awareness Month, so November is Hospice Month. But we were talking about October. We have the celebration of life.
Yes.
And what is that?
That's on October 20th.
Okay.
And it is a like a memorial service for our patients that we lost this past year.
Okay.
And to remember them.
And so family members, friends are invited to participate in that. And where is it going to be held?
It will be at the hospice home this year.
Out in the back in the garden. Very good.
And it's usually about a 40-minute ceremony. And then we have light refreshments afterwards.
Okay.
There at the hospice home.
Just kind of a nice closure for family and friends who've lost a loved one in the past year.
Right. Okay. And we read off the names and we pour sand at the same time, so then we have a container of colored sand at the hospice home with.
So we've been doing that for a few years now.
We have. This is the 11th.
Oh wow.
11th year.
Okay. So they've started a year after we opened?
That's
Right?
correct.
Okay.
Yes.
So every October then we celebrate the past year of.
And we'll read the names of the patients from September 1st of 2011 through August 31st of 2012.
Okay. And then that's that for that 1 year period.
For this past year.
Okay. Very good. So we talked at the beginning of the show of hospice and how the different staff members we have, that it's a team approach to help the family during this time. And obviously, I mean, death is never easy for people, or admitting that it's coming to that point. So that's scary for someone. And even doctors, I think, have a hard time admitting that a patient's dying and that there's nothing more they can do to help them.
Right.
But I think it's important for people to realize that hospice is an answer for them to help them during that time.
Right. Not only the patient but the caregiver or the family.
The family.
To give them the support that's needed
And to help them, I mean, because there's just lots of decisions at the end. And I think what's nice is, too, with hospice, whether they're at the home or at their own home, that it's that quality of life. It's the pain management. And that's why I think it's so important that they get into hospice.
Right. For
because
the comfort care.
The comfort care. That's, that's one of the worst things I think that family members are so afraid of, is to see their loved ones suffering. And whatever we can do to ease that discomfort and make it easier for them, and still have that time to interact with each other. And I've heard wonderful stories of different things that we've done for patients, whether it's helping a loved one get here to see them before they pass, or having a place for them to come in.
Right.
In
the final days.
Yes.
Yeah. Yeah.
And
it's hard for them, and even when the doctor first mentions, or whoever does mention hospice to them, it is very hard for them. So, but it does make it easier on them if they do contact us or call us.
The sooner, the better.
Yeah,
obviously.
And even if they don't choose hospice at that time, for when they do need us, that we're there for them.
So that, I think, is important for them to realize, too, that they can call with questions. Doesn't mean that they're going to have to go into hospice or become a patient, or even admit that I need it yet. But they can get some questions answered. You have
and there are
handouts for them.
times when we do discharge patients from hospice too. They come on our service, and we end up discharging them.
Very good. Yeah, so there's always that hope on the other side, too.
That's right.
So it's good for them to know that they have that resource to answer questions. They have a nurse that will come out, or a CNA that comes out.
A nurse comes out at least once a week.
Okay, good. And what's your number again, Cindy, in case?
It's 681-8710.
Okay, and they can go to our website, too. I know on the website, azkrmc.com, we have information there about hospice. They can look up, and home health is also another program that's available to help before they get that diagnosis. Because I think another thing we've talked about on the show before is palliative care, which is, again, that pain management side. People aren't necessarily dying, but they need help with whatever their situation is, their health issue, that they either have severe pain, or there's just symptoms that they need help getting under control. We have some nurses that are able to help them with that too. So we have a pretty awesome staff.
We also have a lady who does a chiropractor that does acupuncture too.
Oh, that's right, Dr. Dorf. I forgot about that. Yeah, that's new too.
So she does the acupuncture.
Right. So that's even better than having to take drugs sometimes. Right? That's great. Some of the projects too, we were talking about earlier, the volunteers. We didn't touch on the bears that they do. There's some fun things.
The memory bears, right. They make bears, teddy bears, out of articles of clothing of the patient.
Someone could, a favorite shirt or dress.
Shirt, pants, blanket, pajamas. And they take that and they make a bear out of it.
Oh, and then they have something to kind of hold on to.
Right.
That's pretty cool. And what other projects? I know we talked about that they can bake cookies and things in the hospice home, and they've got the bears, but then, and they go to the patient's home to visit or sit.
And we always need volunteers that are willing to go out into the homes and be a companion to the patient.
Great. Okay, super. Well, thank you, Cindy. I appreciate you being on the show today. I think people learned a little bit more about hospice and some of these events. Thanks for joining us today. I hope you learned more about hospice. Remember, if you have any questions, you can call Cindy Vawter at the Joan and Diana Hospice Home. Her number is 681-8710. Or you can go to our website, azkrmc.com, and do a search on hospice. There's lots of information there. We've got some great events coming up in October. I hope to see you at one of them, whether it's the golf tournament, the Spirit of Hospice Walk, or the Celebration of Life. Don't be afraid of hospice. It's here to help. Thanks. We'll see you next week.